Today, I'd like to talk about morphological changes of myofibroblasts in differentiation process promote prostatic fibrosis in benign prostatic hyperplasia. Advanced BPH tissue has particularly abundant fibrous components and few muscle cells in stromal area. Previous study in vitro reported that fibrous process of prostate is associated with myofibroblast by TGF-beta1 and IGF-BP3. However, fibrous process in vivo remained unclear. Therefore, we analyzed morphological changes and the differentiation process of myofibroblasts in vivo using BPH model rat. In this study, we used this BPH model rat. First, we confirmed the time-dependent changes of fibrous component using BPH model rat at 2 weeks, 3 weeks, and 8 weeks after UGS implantation. Fibrous component of this BPH model were increased time-dependently. BPH tissues at 8 weeks have almost fibrous component compared to smooth muscle. In immunohistochemical analysis, myofibroblasts expressing both of alpha SMA and obimentin are shown as yellow. Myofibroblasts were abundant in the stromal area of rat BPH tissues compared to normal tissue. The proportion of myofibroblasts was significantly higher in BPH tissues compared to normal prostate tissue. The localization and the number of myofibroblasts were analyzed in rat BPH tissues to assess the relationship between myofibroblasts and the prostatic fibrosis. The number of myofibroblasts was significantly increased time-dependently from 3 weeks after UGS implantation. Western blotting was performed to examine time-dependent changes of expression of TGF-beta1 and IGF-BP3. The expression of these factors was significantly increased time-dependently from 2 weeks after UGS implantation. In electrical microscope analysis, myofibroblasts have the characteristics of abundant stress fiber in cytoplasm. This analysis showed that the localization of myofibroblasts was dominant in fibrous area of human BPH tissues. On the other hand, discriminated fibroblasts, which have abundant stress fiber, were considered to be a precursor cells of myofibroblasts due to its morphological characteristics. In conclusion, fibroblast to myofibroblast differentiation by TGF-beta1 and IGF-BP3 was identified to be activated during the growth process of BPH, not only in vitro but also in vivo. In addition, precursor cells of myofibroblasts were abundantly located around the fibrous area of BPH tissues and have the possibilities to be associated with tissue fibrosis of BPH. Thank you.
Open for questions.
I'm Bassem Wadia from Mansour, Egypt. The study is very elegant, and the demonstration of myofibroblasts you have done is clearly very nice and elegant. But the hypothesis is somewhat puzzling for me. As a rule of thumb, we have been always learned that it's BPH, that's hyperplasia of the acini and the epithelium or the acinar epithelium of the prostate that matters in obstruction. And we know from urodynamic studies that as of 40 cubic centimeter prostate volume, there is no correlation between obstruction and volume. But starting from 40 and some other studies, 50 cubic centimeters, there is a linear relation between volume and obstruction. This usually means that it is the acinar tissue that causes obstruction, since the density of the acini is much higher than the density of the fibrous tissue. So why in the first place you thought that it is fibrous tissue that matters and it is the reason of obstruction, so that we can handle on the fibroblast thing and see its correlation? Thank you.
Thank you.
Can I ask a question, please? Can I ask a question? It's about your identification of myofibroblasts from using vimentin and alpha smooth muscle actin as markers. How easy is it to differentiate a fibroblast, which also labels for vimentin, from a myofibroblast?
A way to distinguish
Yes.
fibroblast
Yes.
and myofibroblast.
Yes.
But in this study, I use alpha SMA and vimentin as a marker of myofibroblast and fibroblasts to generally fibroblasts to express vimentin only, and myofibroblasts both vimentin and alpha SMA.
So you've relied on smooth muscle actin as the differential between the two.
Sorry, again?
So smooth muscle actin is what you've relied on as the differentiator between a fibroblast and a myofibroblast.
Sorry.
Because you will have it when you if you're using two labels, you've said here you're using alpha smooth muscle actin and vimentin.
Yes.
So both cells will
both have two factors. Yeah, yes.
So you're relying on one having alpha smooth muscle actin and the other not. Is that how you differentiate?
Yes.
How you tell the difference between the two cells?
So sorry, I don't know.
Okay.
I don't believe alpha actin smooth muscle is the best
No.
differentiation between.
Okay, we can talk afterwards. We can chat. Sorry.
Okay. I'm Hiroshi Kiuchi, Osaka University, Japan. So in your study, TGF-beta1 and IGF-beta3 is upregulated in VPH model. So did you check the blocking test of these factors in the model?
Sorry?
Blocking of IGF-1.
Yeah,
because
okay. In this study, we did not inhibit these factors. In previous study, in vitro study, the TGF-beta1 inhibition of TGF-beta1 study is presented, but the blockade of TGF-beta1 have no effective for benign prostatic fibrosis in vitro.
Thank you.
Good. If there are no more further questions, thank you very much.
So, thank you.